Yeah.
I would like to start first by thanking His Excellency the Honourable Chris Dawson, AC, APM, Governor of Western Australia, and Mrs. Darlene Dawson for the generous hosting of this national event. I had the pleasure of getting to know both of you last year through the West Australian of the Year Awards, and I very much cherished all that work on the community and how we can make the state and Australia a much better place to live and die. So I'd like to acknowledge the Honourable Amber Jade Sanderson, MLA, the Honourable Kerry Sanderson, ACO, CDO, the Honourable Dr. Ken Michael, Dr. Katrina Stratton, MLA, and I don't know if Mr. Simon Millman is here, no? And Mr. Rob McKenzie from Perron Institute. And so what an amazing journey I had as the 2023 WA Australian of the Year. What a great honour. It's really afforded me the platform to make so many conversations across Australia, which identified a need for an organisation to support existing compassionate communities and help new ones develop. I went to every party, 65 presentations and media interviews, but the adrenaline kept flowing. It's amazing. So compassionate communities grow connectedness and compassion, working together to create a supportive environment for those in need. For a while, it was thought of as just an aspiration. But now we have the evidence of the benefits, which include significant improvement in social connectedness, increased support networks and links to the community, improved ability to engage in activities of daily living, significant financial savings, the reduction in use of hospital services, reduced length of stay, because people have people around them that love them now in the community, can look after them. So it's a more holistic approach that addresses the social, practical, emotional domains of care. So I finished my speech at the 2023 WA Australian of the Year Award night. We only die once, so let's make it a good one. And then the person from the ABC said, well, that's the end of it, we can't say any much more than that. Let's go home. So Compassionate Communities Australia is about good death, but it's also about good lives. This not-for-profit, soon to become charity, aims to become a hub of knowledge and skills for community-led solutions that lead to social and system change. We have systems that are not serving us well now, but we can all work together to make it better. As you said, Your Excellency, the number of Australians dying will double in the next 20 years, so it's whoever is a baby boomer here. And we will do so in a place that doesn't really reflect our choices and our values. So most of us will be dying in hospitals. We're not going to have enough hospitals or workforce to look after us, okay? So we really need to do something about this tsunami that's coming our way. But yet 95% of the care of the dying is done by our families, our friends, our communities that have been de-skilled throughout the decades because we told them health professionals can do it better. We've got excellent health professionals, but death, dying, grief and loss belongs to the community. The community does it really well. So basically we need now to look at, we need to see death as it used to be. It's a social event with a medical component. Yet it's become a medical event with a social component. So we really need to look differently at this. Of course, the progress of this initiative, and it's just been really 3 months since we basically went, yeah, let's go for it. We've got a lot of support around. Could not have been possible without the amazing support of the Perron Institute. Long before this initiative even took shape. It's amazing. Working at the Perron Institute has been one of the highlights of my career, so thank you for that. The generous support, the generous donation of Professor Steve Wilton and Mrs. Sandy Wilton, this really accelerated the work that we have been able to do. The pro bono work of our lawyer, Mr. Tony Wassa from Sydney, I hope he's attending. The Shannon Company and the Radio Release Media who are doing the PR stuff for this campaign. So thank you for all those who have attended today in person and those who have joined us both from all over Australia and internationally. Compassionate Communities Australia board directors who you will hear from, and the supporting team of advisors we've had. Look forward to working with everyone, absolutely everyone, as these issues affect 100% of us. We're not escaping it, so we really need to do it better. As we weave compassion and connection across Australia. So thank you for listening to me. And I'd like to introduce our director, Dr. Stephen Ginsborg, who's a GP from Sydney. Thank you very much.
Thank you, Samar, for your leadership. Well, why would a GP like me want to be involved with an organisation called Compassionate Communities Australia? Well, back to the Hippocratic Oath. One line has always continued to resonate for me. I will remember, by all that I hold highest, that there is art to medicine, and that warmth, empathy, and compassion may surpass the surgeon's knife or the chemist's drug. And then, in my early years as a doctor, my compass was set when I heard Dr. Michael Ballant's famous statement: the most powerful therapeutic tool that the doctor possesses is herself or himself. So over my 50 years as a GP, it's become clearer and clearer to me that we have, in healthcare, neglected this healing power, as it resides in each person and in the community. And when that power is reanimated and rekindled, we can care for and with each other compassionately and as a team. Medicine and community together. During the last 15 years, I've been involved in health and social policy and have seen the benefits of compassionate communities and their movement here in Australia and internationally. And also how much we have to learn about care and compassion from First Nations people. So I'm very excited to be on the board of Compassionate Communities Australia and look forward to the humanity and conviviality that it will bring to living and dying. So it's my great pleasure now to introduce Dr. Jo Doran, a palliative care physician on the Gold Coast.
Thank you. Millie is beautiful. Millie is 23 and she's trying to live whilst dying. She has a tattoo on her arm that says perspective, and as of Saturday, her friends and family also have tattoos of perspective on their arms. Millie is currently in the palliative care ward. She has a very rare cancer that only modern medicine could meet with a quiet apology. For an experienced palliative care specialist like me, she is as complex as they come. She's got very challenging pain and mobility issues, and all that comes with a 23-year-old trying to come to terms with her situation. But for the community, she's not a complex palliative care patient. She's something different. When she was diagnosed, her community raised over $21,000 on a GoFundMe page within 2 hours to help her and her family, and this is not a wealthy community. This was at her favourite restaurant, which was full of people she knew and people she didn't know. Because when we hear about Millie, something very ancient, something very inherent stirs in us, and we want to step up. We want to contribute. We want to be better than we are. And that is the compassion in compassion. Com meaning with, and passion meaning suffering, but it also means being moved to action. When Millie was feeling stronger, she wanted to go home for a few days. This was very hard for her. She still had pain, she was unable to walk, and she was facing all her fears. Her parents were very frightened that they wouldn't be able to care for her, especially at night, because everything is worse at night. We had secured funding for a nurse to spend the night at Millie's house, but no nurses were available. A family friend who is a nurse stepped in and brought that incredible reassurance and support to help that trip home. A family friend, not a hired health worker, not a palliative care worker, and just something so small as staying overnight can make the unbearable bearable. I have a fantastic photo of Millie in her own bed with her mum, her dad, a little sister, a cat and a dog, all laughing, and it's such a joyous moment. She got back to her favourite restaurant, all with the support of her community. Millie is 23 and she understands perspective. She knows I'm talking today. She wants me to remind you about perspective and compassion and connection. Millie will live long on after she has died, and she has taught her family, friends and community about the importance of compassion and connection. She told me her spirituality is we are all one. I think she might be right. And please let me introduce my friend, colleague, Harpreet Kalsi-Smith, who's also a fellow director of Compassionate Communities Australia. Thank you very much for listening to Millie's story.
Thank you, Jo. Before I commence, I want to acknowledge all of the lived experience in the room and all that you carry. Death, dying and grief affects every single one of us, and you all have your own personal experience. I've been a consumer advocate and supporting people at the end of life, working in between community, health and palliative care for a number of years since my mother's death in 2016. She was diagnosed with idiopathic pulmonary lung disease, and we were soon told that there was no suitable treatment to prolong her life. While she was sick, I was wondering, where is the book or the guide to help me support my family and my mum through her end-of-life journey? I was provided with endless brochures and website links. But when you are in the throes of anticipatory grief, it's like a heavy cloud that you carry. It's harder to see and process normal things. Simple and practical is what I needed. Since that time, I've had the privilege of supporting carers, individuals, and building community capacity to become more comfortable in speaking about death and dying and preparing for it, along with creating spaces for collective grief and healing. There are many examples of where communities caring for each other are coming together in a time of need across the country, but not all are yet confident to do so. Death and dying transcends all the structures and processes that we have built. It is a fundamental time in life, with the right to be holistically supported socially, emotionally, physically and spiritually, to enable people to die with dignity, compassion and respect, but most importantly, kindness is essential to honouring the human experience. And so the heart of the work of Compassionate Communities primarily sits in community development. So we are so encouraged that you are here and would like you to join us on this auspicious day where we are officially launching Compassionate Communities Australia, and encourage you to visit our website, compassionatecommunities.au, to learn how you can support us and each other.